Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter S. Today I'm going to talk about a subarachnoid hemorrhage, which is an emergency situation. Could be serious, could be the complication could be very severe. First of all, let me just bring up the signs for emergency. For those, particularly for those who had a history of hypertension, and this is one of the risk factors, or have the increase the pressure during some special activities, and then develop this sudden headache. The headache is like you never had it before. It's very cruciating headaches, and for the older people and had history of hypertension, or if you're bearing down or increase the intra-abdominal pressure, or suddenly develop this the headache, very serious. If that's the case, don't hesitate. Do not move too much. Just stay still. Call the emergency. So that's probably the sign of the this subarachnoid hemorrhage, which abbreviated as SAH, because the limited movement is one of the strategy to manage this condition. So anyway, so this is about the emergency situation, and definitely you cannot manage at home. It has to be evaluated by the physician. Make sure the hemorrhage is really located in that subarachnoid and there's no intracranial bleeding or any other conditions associated with this. So it has to be managed by the physician. It's really emergency. So this is let me just why it is so critical for this. This is for this condition, and to stay still. And let me just introduce about the structure. I think I mentioned it before. 3 layers of the maters or the meninges were really wrapped around the brain and also the spinal cord. So this is one of the dura mater, which is really attached to the skull. It's very tough. That's why it's called dura mater. It's kind of with a strength. And then underneath of this dura mater, close to the brain, is the subarachnoid mater, which rich of blood vessels, small blood vessels, and circulating and generating the CSF. And there's another layer which is attached to the brain. There's no space, called the pia mater, which is very soft, very thin. So there's a space between arachnoid membrane and the pia. The arachnoid mater and the pia mater. That's where you draw the fluid for the CSF. So anyway, so this is the and then the hemorrhage into this space, the space between the arachnoid and also the pia mater, which basically is brain. So because this pia mater is it's just separable from the brain. So this is about the structure of this and the space where the breathing into, and how, like the risk factors. I already talked about that. Is the history of hypertension. That's one of the most common risk, and also the special activities like the bearing down, hold your breath too long, and any other activities which increase the intracranial pressure or increase abdominal pressure. So if that's the case, or hypoxia, that's the risk for this bleeding. And the symptoms, like I mentioned, it's a severe headache. It's described as the headache you never had it before, because of this bleeding not just only increase the volume, but also irritate the meninges. So cause meninges are the structures that the reach of the nerve sensors for the pain. So that's why the pain is so, like, is described as cruciating headache. Never had it before, and sometimes you feel like expanded or throbbing. But that's anyway, the most common presentation is the headache. Never had it before. Hypertension, you might have headache here or there, but for this headache caused by the subarachnoid hemorrhage, that's intolerable, and also never had it before. It's very severe. and sometimes may or may not associate with neurological deficit or cannot move arms. Usually it doesn't have any of those, just the headache. So if that's the case, and then you need to go to the emergency room, the diagnosis is really to draw the CSF, the cerebral spinal fluid, can tell the red blood cells and hemorrhage to diagnose. In terms of the management, usually just the really limited activity, limited bed riding, rest completely. There's no recommendation for the medication to stop bleeding unless the bleeding is ongoing. So if just let it, unless you're using the blood thinner, need to be stopped, or you have the coagulation problem. Otherwise, the management is kind of support to observe closely without further bleeding, and let it absorb and let it calm down, rest by itself, and to absorb it, because that space is kind of limited, and if it is not into the brain, so that's the basically it's how to manage it. And in terms of the consequences or the prognosis, usually a majority of the case with this disease can be recovered, but if you did not follow up the physicians, otherwise like completely limit activity, completely bed resting, without any activities for increase the intracranial pressure or the bearing down, without any these kind of activities, you need to follow your physicians otherwise completely. If not, then probably the bleeding may be getting expanded or extended into the brain, or associated with other intracranial bleeding or thrombosis, which is part of the stroke. But usually, I think at least 90% of patients can be recovered without any sequelae or without any problems. But has to be very closely observed or monitored by your physician, and to make sure you're not do anything that can cause increase this pressure in the brain or the blood pressure elevation. So that's basically the management, supportive, and completely limit activities or anything can increase the blood pressure, increase the intracranial pressure, or any activities of bearing down, something like this. So that's completely restricted. So this is about the management of this. The prognosis I mentioned pretty much can be recovered by those patients who had previous SAH or subarachnoid hemorrhage, had increased risk of stroke later on, and also has to be managed the blood pressure closely to control the blood pressure completely. And also in certain time there's no blood thinner can be used. So for have other medical problems, or for example AFib, and have this SAH, that's really kind of challenging to manage. And so this is about the subarachnoid hemorrhage. That's quite common in older people with history of hypertension. So the take-home message for this video is, if you're interested, you can search. And for those who had a history of hypertension, particularly the hypertension is not very well controlled, suddenly develop this headache, which you never had it in your lifetime. So that means really something serious. Go to the emergency, do not hesitate. So this is about the video here, and thank you for watching. I will see you next time.